Okay, so Colleen's still trying to get in.
Right. And we're broadcasting now.
Well, just welcome everyone to the the Missouri Autism Community Advocacy webinar. We're just going to wait a few minutes, let everybody kind of join in, and as soon as we do, we will get started just momentarily. We have a really good number of attendees. Thank you everyone for coming on board this afternoon. We're really excited to bring this to you today. I think we're just waiting for just one or two more to come on board for our panelists, and then we'll get started. Oh. All right, I see one of them coming on. Yeah, she came on. Okay, we ready to get started then, I think?
Yeah.
Okay, so, well, welcome everyone to our, we heard you, Colleen, we got you in there. Okay, so I think we have all of our panelists here now, which is great. So again, I just want to introduce myself. My name is Lisa Radke. I'm the Executive Director for the St. Louis, Kansas City, Michigan, and Indiana markets. And really looking forward to being able to bring this webinar to you today. Got a couple of people I'd like to introduce you to, and if they're on the call, we have, just want to introduce our team to you. I have Michael Quinn, who is our Director of Development for St. Louis, on board with us. We also have Stacy Gershon, who is our Manager of Field Development, and also Tracy Howell. She's also our Manager of Field Development for the Kansas City markets. And great panelists here for you today, so let's get started. So one of the things with that we are very dedicated to here at Autism Speaks is our mission. I'm not a proponent of reading necessarily a presentation slide, but this is so important to us and our message is very important, so I am going to be very specific about what our mission is. And so Autism Speaks is dedicated to promoting solutions across the spectrum and throughout the lifespan for the needs of individuals with autism and their families. We do this through advocacy, support, increasing understanding and acceptance of people with autism, and advancing research into causes and better interventions for autism spectrum disorders and related conditions. We do this through a few, through our objectives, and we have 5 pillars that we are very dedicated to and committed to. And I need to put my glasses on for this one here. Can't see so much. So through partnership and collaboration, we are committed to increasing global understanding and acceptance of people with autism, being a catalyst for life-enhancing research breakthroughs, increasing early childhood screenings and timely interventions, improving the transition to adulthood, and ensuring access to reliable information and services throughout the lifespan. So these are some of the topics that we're going to be touching upon in addition to our advocacy and our resources that we have available. And with that, I would like to introduce you to Judith Ursity. She's our Director of State Affairs within Autism Speaks. And Judith, the stage is all yours.
All right. Hello, Missouri friends. Thank you so much for joining us today to talk about advocacy on the federal and state level. And also we're going to talk a little bit about resources, services, and supports that are available to the autism community right now during the time of COVID-19. I'm the mom of a 16-year-old son with autism. He also has a severe intellectual disability. We struggle with OCD. we have a lot of different challenges that we face, and that's only one profile of, you know, someone with autism. We all know autism comes in different levels: level 1, level 2, level 3. People who are diagnosed with autism are all ages. They live in different parts of the country. We've been hearing, though, some recurring themes as we connect with the community around us during this time of pandemic. We all know that educational services, for those that are still in the educational system, those have been discontinued or severely disrupted. Day programs that people depend upon have been closed, clinics closed. There's been a shift to telehealth, and I know in Missouri there's been a shift to telehealth anyway, but there's been an even more expedited shift to telehealth during this time. Mental health supports for families, for people with autism, for their family members, those are needed. There's a lack of connection to the community and supports, and this is so important for individuals with autism, and there's been such a strong movement nationwide to make sure that people with autism aren't isolated and segregated, but rather they're a vibrant part of our community. My son Jack, every Saturday night, asks to go to get wings at Outback Steakhouse, and we've been doing that for more than 10 years, every Saturday. And the folks at Outback know him, and they know when he walks in, and they know, you know, what kind of juice he likes to drink and what he likes to order. Definitely always they have the wings ready to go. And for him, they're his touchstone, their connection, and they value each other. And he doesn't have that right now. It's not the same going. We do go to support our local Outback. We want it to stay open so that he can still get his wings and have his connection. But driving through and picking up is not the same as that community connection. So it's just one small example of what's lost right now, but it really makes a big difference to people with autism. Employment has been disrupted. And so many people on the spectrum have worked so hard and have so much to offer in the employment arena, and now that's been interrupted. Respite is not available, and respite's so important for families who are living that 24/7 stressful life. Routines have been disrupted. Families have lost their income, and we know that many families that live with autism struggle economically. And to make it worse with loss of income, it's just devastating. There are challenging behaviors that our community faces. People with autism can become aggressive. They can have self-injurious behaviors, especially when routines are disrupted or there are stressors that are around. It's just a hard time. It's hard for them. It's hard for those around them. And then, of course, just access to healthcare with the right kind of supports right now is really challenging. So many family members we've heard from are concerned about potential hospitalization of their loved one with autism. If perhaps they get COVID-19, will they be able to have visitors with them in the hospital? And I know in Missouri there are different policies in place for different hospitals. And so it's just a scary time when you think about that. So what we're trying to do at Autism Speaks is make sure that we're connecting with you. We're hearing about those challenges. And if we've missed anything on that list, please let us know. You can put it in the chat box. Today you'll notice that your mics aren't live and your video is not live, just to save bandwidth, but we do want to communicate with you. So if you have something you want to say, if you want to add to that list, or if you have a question, please put it in the chat box, and we'll be monitoring that. Kelly Hedrick, who heads up our state government affairs and grassroots at Autism Speaks, is monitoring the chat box with folks from our autism response team. So we do want to hear from you. If you have a super specific question, and a lot of times we do, please know that we have an amazing autism response team. I think this is probably one of our best kept secrets. The folks from the ART are there to answer questions. You can call them. There's a number that's provided in Spanish if you need that. And then also you can email, which is my favorite mode of communication, help@autismspeaks.org, and we will provide information and resources to you. And the folks who monitor these contacts are incredible. They're knowledgeable, and they're here to help and support people from all levels of ASD. All right, so that's kind of where we are, and that's how we've gotten to the point where we want to provide federal advocacy information and state advocacy information to you. So I'm so excited that today you get to meet Dave, who heads up our federal team. He's going to be providing a federal update. I'm going to talk with you about concerns on the state level. And then Colleen is going to be talking with you about supports and services in the community. So first and foremost, let's talk about what's going on in DC, and there's no one better to explain that to you than Dave. So Dave, if you would please take over. Thank you so much for being with us today.
Thank you, Judith, and great to be with you all today. So as Judith mentioned, my name is Dave Gonski. I work on our federal affairs team based in Washington, DC. And I wanted to talk a little bit today about what has been happening in Washington as it relates to the COVID response. Some of our advocacy efforts specific to the autism community, and to talk about what's next. Admittedly, we're not going to be able to get into every detail of all of these laws that have passed in the past few months, and would certainly be happy to take questions either now, or if you think of something after the fact, please don't hesitate to email. And so I'll do my best to get through a lot of information without not being too confusing. And again, happy to take questions. So in response to the COVID pandemic, Congress has worked actually relatively quickly relative to the way that they usually are able to get things done on a number of different fronts in response. Since March 6th of this year, several bills have passed, and they are often referred to as COVID-1, COVID-2, COVID-3, just in the order that they were passed. So the first one, as you can see here, was passed on March 6th. This was COVID-1, the Coronavirus Preparedness and Response Supplemental Appropriations Act. This was really the first response bill to the crisis. It provided a significant amount of emergency funding for the public health response, essentially, and several other important things as well. But it was really kind of the first tranche of money that went out to just try to initially respond. On March 18th, Congress passed the Families First Coronavirus Response Act, which is also known as COVID-2. This was a bill to address a lot of concerns that individuals and families are experiencing. So in particular, providing emergency paid sick and family leave, providing free COVID-19 testing where available, of course, expanding food assistance, unemployment benefits, and then providing an across-the-board increase in Medicaid funding. This was a 6.2% FMAP, as it's referred to, federal matching for Medicaid. So those are two bills were passed within a 12-day span, 2-week span. And then on March 27th, the Coronavirus Aid, Relief, and Economic Security Act passed, also known as COVID-3. I'm sure all of you have heard about this bill in one way or another because it was so big in terms of the amount of relief and different provisions that were included. So it was $2 trillion in funding. This included the $1,200 per person economic impact payment or stimulus checks, $500 for dependents under the age of 17. This is the bill that increased unemployment benefits, so the additional $600 that's included on top of the regular unemployment benefits that individuals can receive. Hundreds of billions of dollars for the public health response, going to hospitals, to physicians, frontline health workers, hundreds of billions for state and local governments to address the specific COVID-19 related concerns. The Paycheck Protection Program, which we've listed here, the assistance for small businesses and other employers to retain employees. So that was $350 billion provided to as essentially potentially forgivable loans to small businesses to allow them to continue to keep on employees. There was about $30 billion of funding for schools. About 13 of that was for elementary and secondary education. And Judith will get into the details on that a little bit later on how that's being allocated and what Autism Speaks is doing to advocate on the state and local level. And lastly, it extended the Money Follows the Person program through November. So if you go to the next slide, please, Judith. Thank you much. So as I mentioned, the CARES bill, the COVID-3 bill, included the Paycheck Protection Program, which was this large pot of money for small businesses. You may have read news articles about this. It's been a big story for the past month or so, that that money ran out very quickly. There's just tremendous demand from small businesses to access the program. There's been some back and forth about some larger businesses that were able to get these loans, and there's some public scrutiny. But in any case, this program ran out of money. And so there was a need to replenish that fund. And over the course of several weeks, there was a bunch of negotiation, and that money, there was additional several $100 billion put into that program. In addition to that, there was funding for hospitals and testing in the tens of billions of dollars as well. It wasn't a small amount of money. However, the reason that it's referred up here as COVID 3.5 is that, since March 27th, there's been an acknowledgement that there's likely going to be another very large, in the trillions of dollars worth package of things to assist individuals and families and businesses and state and local governments. And so this COVID 3.5 bill was very narrowly targeted to just address these specific things that we've outlined here. But there's still a lot of negotiation about additional relief to be provided. And so that kind of brings us to our advocacy priorities during the crisis and things that we have been pushing with our legislative champions, with other members of Congress, with congressional leadership. Both in terms of some of the previous bills, but also going forward. So the first thing we have listed here is additional funding for home and community-based services. Very important, and one of the things that some of the proposals have been looking at is providing this boost to not only provide additional people access to services, but to ensure the continuity of the workforce through whether it's additional pay that's needed, certainly PPE that is needed in order to provide these services, and a number of other things. And so that's something we've been advocating strongly for additional funding there. Additional funding to meet the educational needs of students with autism. I know Judith already touched on this, that right now it's a very, very difficult situation, and we want to ensure that students are able to get the best access possible to services during this time that they're at home. But also recognizing that when students return, there's going to be a huge need to address regression. And we want to make sure that school districts have the money that they need to provide the services that we know our students are going to require. And so that's something we've been advocating strongly on. Protecting the rights of students under the Individuals with Disabilities Education Act and other laws. There was a lot of swirl of information prior to the passage of the CARES Act on March 27th that Congress might waive the core protections of IDEA. We advocated against that. Many other advocacy groups also weighed in. A lot of families and individuals weighed in. And fortunately, there were no waivers of IDEA included. What Congress required was that for the Secretary of Education to issue a report within a month outlining any needs for waivers that Congress might need to pass. Secretary DeVos released her report on April 27th, and In that report, she said that there were no waivers that she thought were needed to the core protections of IDEA. So we, of course, were happy to see that there was no recommendation made to waive the core protections of IDEA. However, we remain vigilant on this front and know that, just because this bad thing did not happen, that we still have a lot of work to do and in ensuring that our students are getting the educational services that they have the right to. Expanded access to telehealth services for healthcare needs and ensuring that they're appropriate for individuals on the spectrum is something we're continuing to advocate on. As I mentioned, in the CARES Act, there were $500 economic impact payments or stimulus checks for dependents under the age of 17. We know, and having heard from so many in our community, and just knowing that this is leaving so many people out. In terms of an equity issue, we have been advocating for that to be changed to allow dependents over the age of 17 to qualify, so those $500 payments can be sent out. There's a lot of support in Congress for this. There's a bill that has over 150 co-sponsors, or about 150 co-sponsors in the House of Representatives, and I know there's an analogous bill in the Senate, and there's been a big push in a bipartisan way, I should add, to reverse that. The next one, according caregivers of adults with disabilities, the same emergency paid sick and family medical leave policies that are accorded to the caregivers of children. This is referring specifically to the emergency paid sick and family leave part of one of the bills I had discussed before. There are a number of categories that will allow you to become eligible to avail yourself of those benefits. Of the emergency paid sick and family leave. One of the things that the law wasn't clear about was, while caregivers of children whose school is closed or childcare center is closed were eligible, the same wasn't necessarily true, or at least it was written vaguely in terms of caregivers of adults with disabilities whose day program or other normal source of care is no longer available. We advocated with the Department of Labor, again, along with many other groups, individuals, families, and fortunately they've implemented the law in a way that allows those caregivers to be included and eligible. And lastly, but extremely importantly, preventing discrimination in treatment decisions and care allocation based on disability. We are heartened that the Office of Civil Rights, Department of Health and Human Services sent out guidance to this effect. We applauded that, but also continue to stay vigilant on this front as well. And the last thing I'll just mention is Congressman Chris Smith and Mike Doyle, who are the co-chairs of the Congressional Autism Caucus and who have been really just great champions for several decades now in Congress. We've been working with them and talking with them pretty much every few days with their staff and talking about these priorities, communicating what we're hearing back from the community directly to them and to other members of Congress. And they've sent letters to congressional leadership advocating for many of these priorities. Go to the next slide, please. So what's next? So as I mentioned, negotiations continue to be ongoing regarding a big, large additional relief package. On May 15th, so last week, the House of Representatives passed the HEROES Act, which is a $3 trillion relief package that includes money, about $1 trillion for state and local governments, housing funds, billions of dollars for education and other healthcare related initiatives. It's a large bill, it covers a lot of ground. What I'll say is that it's essentially the opening salvo in terms of the actual legislative negotiations. And so while the bill passed in the House, it still would have to go through the Senate, and the Senate hasn't indicated that they're going to be taking this up, at least anytime soon. And so I want to highlight a few things that were included in the HEROES Act that are priorities of ours, but also with the caveat that this is not the final law. It's still got to go through more of a process before we know what will be in the final version. But the HEROES Act did include a substantial increase in funding for home and community-based services, 10% increase, as well as an increase in Medicaid funding that would also go towards that, and across the board Medicaid funding increase, I should say. $100 billion for education. This is in addition to the $1 trillion as an assistance that I mentioned a moment ago. The dependent issue for economic impact payments was addressed, and it would actually provide retroactive payments, and then make eligible everyone essentially for an additional $1,200 payment in going forward. It clarifies the eligibility for emergency paid sick and family leave for caregivers of adults, and included $10 million for Developmental Disability Act activities. So as I mentioned, the Senate hasn't taken this up yet, and has not indicated that they will take up this bill. I think there will be a lot of negotiations amongst congressional leadership over the course of the next several weeks and month to get to a final version. What I can tell you is, in terms of Autism Speaks, we're going to continue to be pushing on these priorities to try to preserve some of these really positive provisions that were included in the HEROES Act, but also continuing to listen to the community and try to continue to push even additional priorities forward. And I apologize if you hear my 3-year-old tantruming in the background here, but anyway, happy to take any questions that you all may have on any of this.
She's annoyed with Congress, like all of us. Are there questions, Kelly?
Sorry, it took me a longer than usual time to get off mute. One question, Dave, can you expand a little bit on what Money Follows the Person program does?
Sorry, I forgot I had muted myself because of the tantrum there. Sure, so it's a program that's essentially designed to try to allow individuals with disabilities to be able to access home and community-based services rather than have to receive services in an institutional setting. And so this program allows for money to go to states in order to be able to facilitate that program. It's one of these things that has been authorized, it's been passed in law, and then it needs to be renewed every so often. And we've been advocating for an expansion in the amount of services that are covered, and in a longer term renewal of this program. Unfortunately, Congress has kind of continuously just kind of kicked the can down the road on the existing program. And so while it's important for it to be renewed, we would hope that there'd be more of a comprehensive approach to this that Congress would take, and we'll continue to advocate on that. I'll put some information in the chat box as well, so you can read a little bit more about the program as well. And then, and if you have further questions, please don't hesitate to follow up, and we can connect you with one of our experts on our team as well.
Great, thanks, Dave. The other question we had was just from someone that I think is new to Autism Speaks and how they can get engaged with us. So I gave some suggestions, and we'll make sure she has information on how to dive right in and get engaged with us in whatever way she's interested, from local walks and events to advocacy to utilizing services through the Autism Response Team and other ways of engaging. Thank you.
Thanks, Kelly. And I'll add too, with Money Follows the Person, Missouri actually does have a Money Follows the Person demonstration through the Missouri Health in that program. So we can send you additional information about that as well. Okay, so let's talk a little bit about state advocacy. I know you all remember your Schoolhouse Rock if you're from the 70s like I am. And I'm just a bill and all that kind of stuff. Well, a lot of stuff happens in DC as pictured in that cartoon, but even more happens on the state level. And so I love talking about state advocacy. So we're going to talk a little bit about what's going on for you. I know your legislature just finished up kind of a short interrupted session. They might be coming back later. So there's a lot of work to be done on the legislative front, but then there's also, in this situation, a lot of work to be done with your various state agencies. If you're walking in the world of autism as a provider, as a family member, as a person with autism, you're going to be pulling resources quite likely from different areas. So healthcare is one. We've talked a lot about home and community-based services, HCBS. If you use waiver services, that's what those are. And then also most people with autism at some point in time are going to be dealing with early intervention and or special education. So we've been trying to have some really direct advocacy in those areas, tracking things, engaging on things that will affect our community. So one thing that we've done is we've tracked the states as they're applying for emergency waivers through the federal agency, CMS. So CMS is the federal agency that oversees Medicare and Medicaid, a big chunk of state budgets, of the federal budget. And so CMS came out early on with opportunities for states to apply for waivers, but the goal pretty much was to make things more flexible. As you know, if you're dealing with Medicaid or special education or anything related to the government, there's always a lot of bureaucracy. There's always a lot of paperwork and requirements. And of course, we want to make sure protections are in place. But when you're in a crisis like this, you know, time is of the essence. So Missouri applied for and was approved for an 1135 emergency waiver for the Medicaid services that one might receive in the healthcare areas. So if you get your health insurance through Medicaid, and if you're going to the doctor or you're getting medications refilled, this will affect those sorts of services. So prior authorization requirements have been temporarily suspended. Pre-existing authorizations are being rolled forward. Pre-admission screening and annual resident reviews, those have been suspended for a bit. State hearing requests, appeal timelines, those have all been modified because life, you know, has just halted for a bit. There are modifications around provider enrollment, and also some of the services are being allowed in alternative settings. If you want to know more details about what's been approved in that 1135 emergency waiver for your healthcare under Medicaid in Missouri, there's a link here, and we're going to send out all these materials after the presentation. So if you want to go through the PowerPoint and click through the links, you can get even more information that way, or you can view it later. We're recording this, so you can always go back and view it. If you really, you know, can't go to sleep one night, you can just turn this on and it might just put you right to sleep. Hopefully not. All right, so one big thing, a big shift that we've experienced nationwide and that you've been experiencing in Missouri is just the shift to telehealth right now. And Medicaid early on, federally, they said, hey, we want to make sure that our participants have access. So they provided a lot of flexibility around that. And it's not just for people who are unable to go to the doctor, but also for those who are advised not to go because it's not safe for them. I know my child's pediatrician, they're not seeing any sick patients right now. You can only go to the doctor's office if you're well. So it's a complicated time, and so telehealth is really critical right now. So it's good that your director of insurance issued a bulletin March 26th. And they did so after the governor came out and provided some guidance early on saying that telehealth is important and that it should be covered in Missouri. It should be covered at the same rate as if the service was being provided in person. So if you're having any issues with your insurance covering telehealth, if it's a state regulated plan, if it's a Medicaid service, it really should be covered. And it covers things like I mentioned, like doctor's office visits, things like that, but also the services that the autism community really depends on, things like behavioral health treatments, including applied behavior analysis, therapeutic services like speech, OT, PT. There's also psychological, psychiatric care. Those services can't be suspended, just full stop. Because of the pandemic, it's so important that people have access to the supports and services they need. So telehealth is supposed to be covering those right now. If they're not, we definitely want to hear from you. We've talked quite frequently during this presentation about HCBS, home and community-based services. Those are, as I said earlier, those waiver services that you get through the Department of Social Services, the DD area in Missouri. And Missouri, like more than 40 states now, has applied for a waiver for their waivers, a waiver for their waivers. And it's called Appendix K. And this, as of yesterday, had not yet been approved by CMS for Missouri. I'll check again today to see if they approved it. Missouri filed it on April 10th, so I would expect the approval to happen at any time, as CMS is moving these through pretty quickly and working with the states. So keep in mind what I'm sharing with you here that's in Appendix K, that's going to affect those waiver services that you get. This has not yet been approved. We would think that it very likely would be based on what we're seeing in other states. This is consistent with what we're seeing in other states. And as I said, more than 40 states have approved Appendix Ks during this crisis. So there are, for instance, with some waivers, allowing certain family members to exceed 40 hours per week authorized in the support plan. Out-of-home respite and temporary residential services may be provided in any setting, just to be cognizant of health and safety. If a day hab location closes, habilitation can be provided in a home, a residential setting that's a waiver residential setting, or places like a hotel, a shelter, a school, or a church. So day hab services can be provided in alternative settings. There's a temporarily permitted payment to family members for providing services. And there are some qualifiers around this. So this wouldn't apply for like ABA therapy or anything like that, but for services that are more general in nature. And if you look at the bottom, additional details can be found. So if you really want to look at the fine print, please do. But the bottom line is that family members can be paid as direct support providers for people with autism right now, if the Appendix K is approved, which we think it likely will be. Provider qualifications are modified kind of in general, things like background checks or fingerprinting, and person-centered plan development process has been modified too. Again, it's all about flexibility, just trying to make the process less restrictive. And again, in normal circumstances, these protections are important. We want to make sure consumers are safe and they have access to evidence-based care. In this situation, we want to make sure that care continues in a modified way until we can get back to what they're calling the new normal. So again, I encourage you, if you want to look at the application, the Appendix K, it has all the details there, and this will affect your waiver services in Missouri. And we'll let you know also too. I would think this would be approved at any time, so stay tuned for that. Okay, let's talk about another complicated topic, which is special education. According to the Missouri DESE, state and local education agencies are testing uncharted waters together. And I would add to that, it's not just education agencies, it's the students, it's the families who are trying to figure out what to do when they have a child with autism who can't necessarily attend to remote learning, if they're not engaged with the screen, or if it's just too much for them, if they're used to being in school all day and now they have very limited access to services. We're hearing of students, just being given packets or nothing to work with, and it's just a really challenging time, uncharted waters for sure. There's a link at the bottom of this slide that shows, it's a question and answer guide that DESE has created for families. I would say there are still a lot of unanswered questions that have to be resolved in the coming weeks for our community. One thing that's not unresolved though is how much money is coming down from what Dave was talking about, the CARES Act, when there was a large amount of money coming down for education. And we know the state of Missouri has received K through 12 allocation of $203 million, and a portion of that is supposed to go to special education. There's money that's come down for post-secondary education, $175 million to Missouri. And then Governor Parsons has also received $54 million that he can use at his discretion for education. It's not for special education specifically, but we want it to be allocating some of those funds. We want him to be allocating some of those funds for special education. So we're asking, that as he's looking at this $54 million, he think about allocating money for access through assistive technology, hardware, software, Wi-Fi. No matter where you live in Missouri, we're worried that people don't have access to remote education. We also are concerned about the little ones who might be transitioning out of early intervention and into special education and what that process looks like for them. We're worried in general all across the educational lifespan for students who are not accessing the services that are on their IEPs. They're very diluted services, and we don't want this to be a situation where families just wait and then they hope sometime in the future that something will be made up. We'd like the governor now to take some of that $54 million and start filling in the gap now, provide services as soon as possible, even over the summer, to students with autism, to try to start filling in some of the gaps that were created because of the school closure. And then we're also very worried about students who are transitioning into adulthood. Are they receiving the appropriate services to transition out into adulthood? What does that look like? And we don't want them just to be pushed out and not receive the services that they should have from a transition perspective before they exited. So those are kind of the key areas of focus that we're thinking about with allocation of these funds, $54 million of which the governor has discretion. And so those are some of the priorities that we're looking at. So we continue to work on this, monitor this, even though the legislature adjourned, and they approved a budget, they're going to come back probably. And in addition to what the legislature is doing, there's just work to be done with the governor, with the state agencies, with the DESE to make sure that they're doing right by our community. So if you have questions or concerns or suggestions, please stay in touch with us. You can follow us on Facebook, on Twitter, on Instagram. If you're not a social media person, I'd say that's wonderful. Social media sometimes can not be the healthiest place to be, although there's a lot of good information there. But you can also just go to our website, autismspeaks.org/advocacy. There's a wealth of information there. And you can also reach us if you email advocacy@autismspeaks.org. We want to be here to hear from you and to help. So with that, I will stop talking and see if we have any questions or comments.
Yes, Judith, we've got one that I think pertains to the Appendix K application from Missouri. Will parents be able to provide PA hours or just other family members if that's approved?
So the way the Appendix K application was written, it couldn't be anyone who lived in the premises. So I would say that probably excludes parents unless there's some way to get around that. And when I read that, I thought, wow, that in other states, we have actually seen where family members on site can be the paid caregivers. I'm not sure why Missouri chose to word their application, and it'll be interesting to see what's approved too. But the way it's written, it said it can be anyone who lives in the house. So.
Okay, thank you. And we have one comment that's a good one. School districts nationally and locally in Missouri are looking at deficits in budget. Cuts in spending are inevitable. Support services for students with autism, like behavior specialists, behavior analysts, are not usually considered essential by districts and will be facing scrutiny. Advocacy in this area would be helpful, as they will likely be critical to reentry, but looked at first when considering budget cuts. So definitely what you just covered with federal money coming down that can be plugged in, and you know, it's going to be a continued effort, but just wanted to share that comment as well.
Yeah, and that's a specific area that in Missouri, that's really where they're gonna look first to cut. We can certainly advocate around that because it's so important for our community. So thank you for that. Okay, all right. With that, if there are other questions, we will respond after through email or interaction with you. So please don't be concerned if we didn't answer it verbally during this presentation. For the sake of time, I'm going to shift over to Colleen, who has information that I really want you to hear about regarding the supports and services that are available through Autism Speaks right now for all of you. So Colleen, thank you so much for being with us today.
Judith, I'm sorry I had a hard time getting on, everyone. I apologize if I interrupted at the beginning, but I'm happy
you
to be
did.
here.
Today's a day of glitches for some reason.
I know, I don't know what's happening with Zoom today, but this is our life now. But I'm really excited to talk about what we're doing because we have some great resources and we want to be here for you guys. I will tell you that I've been directly involved in the autism community professionally for over 30 years. And from a professional and a provider standpoint, you know, your providers miss your loved ones for sure. I know that that's true. And you can go to the next slide, Judith. Just, you know, we know that this is so hard, and it's hard on everybody. Like Judith said, it's not just hard on our loved ones with autism, it's hard on parents because parents are now therapists, parents are teachers. They're trying to work from home and be productive and also be working with their loved ones with autism. And we know that's really, really difficult and very, very challenging. We also know that a lot of adults on the spectrum have lost their jobs and are having hard times if they are employed with some of the restrictions that are being put in place and workplace modifications during COVID-19. An example of that we received, and I'll talk a little bit more about the autism response team in a minute, but I know that there are some phone calls and emails that have come in from adults on the spectrum who have jobs that require masks. And because of sensory sensitivities, they don't like to wear masks. And so that's been a really big challenge. So it's like every single day something new is happening with this pandemic, and we're really trying to be as proactive as we can to keep up with some of those issues and develop resources as those kinds of situations arise. So please make sure, you know, a quote that I've heard that I use really frequently is that we are all in this, we're not all in the same boat because everybody's boat looks different. But we're definitely all weathering the same storm. And, you know, we don't have answers for every single question, but what we do have is support for you in any way that we can possibly help. So please know that, and I'll talk a little bit more specifically about the kinds of resources that we do have. So if you go to the next page, Judith, if you go to Autism Speak, oh, excuse me, I'm jumping ahead of myself. So our autism response team, you've seen this slide twice now in this presentation, and that's on purpose because I think Judith mentioned that this is the best kept secret at Autism Speaks, and we don't want it to be a secret. We want people to know about our autism response team. They're a wonderful team of trained individuals who have backgrounds in autism specifically, who've worked in this field and who are live taking phone calls, chats, and emails because people have different ways and methods of communication that are particular to their need. And anybody can call these lines. It's a toll-free number. It's 888-288-4762. We have dedicated Spanish-speaking associates, and that number is 888-772-9050. And we also know that a lot of times, especially autistic individuals, don't want to have a phone call conversation because it can be difficult sometimes. So we like to make sure that we have an opportunity for people to send an email, and that email is help@autismspeaks.org. They are available Monday through Friday, 9 a.m. to 5 p.m. Eastern time. I can tell you I've been helping out periodically with this team. They are a busy bunch of individuals and wonderful. And they will individualize resources and supports to your particular situation. And anybody can call this. We have parents that are contacting loved ones, caretakers, professionals, and we get a lot of phone calls from individuals with autism themselves. So please share this resource out, because we're here for the community, especially during this trying time. Next slide. So when this all happened, it was really crazy that we had to kind of shift gears with our services and supports team and really build supports out around COVID-19, because we know, every single population is affected by this, but I will tell you, I have not yet met a population that's as affected as the autism population. It is really, really impactful, and it's really difficult. So if you think of all the different facets of a person with autism's life every day, and the routines that they thrive on, and they like the schedule, and they like to have the every single day the same thing going on, and that's disrupted, it's really difficult, and it's difficult for everyone. It's difficult for families, it's difficult for their teachers and therapists. So one of the things that, and we have a myriad of resources, but the dealing with school closures is a really nice one. So the how to handle clinical care during this time. What should the autism community know about the coronavirus outbreak? And again, we're adding to these materials. The other thing that's wonderful is that we can't do this alone. There are a lot of organizations out there doing fantastic work and have amazing resources around this as well. So we're sharing those out as we learn of those. So a great way to see some of those, especially for local resources, is if you go to our Facebook page. It's a group now. We formed Facebook groups and Instagram channels. And if you check back regularly, you'll see updated information. The other thing that's fantastic, and the time is ticking to partake in this, is that we have partnered with OCALI. That is the Ohio Center for Autism at Low Incidence. And they have provided with us in collaboration beginning April 9th through the Autism Certification Center, free hours of training. There's 30 plus hours of online video learning resources, and I believe they're open until June 1st. So you have about a week or so, a little over a week to take advantage of those. And I know it's kind of silly to say if you have free time on your hands, because you may not, but there's some great different modules on here. So take advantage of those if you can, because as you're normally, you have to pay a fee for these, and they're free. And I've done a couple of them, and they're actually really, really good. And they're broken out into different age groups, and it's some great resources. Next slide. So if you go to the Autism Speaks main website, you'll see this page. You'll also see at the top right now a big gold banner pop up at the top, and that's where all of the coronavirus resources are stored. So if you click on that, then you'll see a bunch of different, like I just showed in the previous slide, a bunch of different topics. And if you click on each one of those, just a lot of different resources will open up. So we're trying to add to these as we can. There's just fantastic things on there, so please access these. The other nice thing is if you haven't gone to our website in a while, it looks a little bit different. We revamped it about a year and a half ago, and we made it more user-friendly. So if you go, you can search information by topic, which is really nice. You can also make it searchable by level of need, age, which is fantastic. So as you can see, some of the categories down here: financial planning, safety, school, technology. There's just really, really good resources on here. We have also have over 48 free downloadable toolkits that are available on this website as well. And again, if you're looking for something specific and you can't locate it, you can always call the Autism Response Team, and they will send you a direct link to whatever you're looking for, which is also great. I think that is it. So we have, I think, a little bit of time left for questions if anybody has one. I think we have 5 minutes left. So if any other questions or comments came in, I think we have a couple minutes to take those. But thank you so much for your time, and please stay safe, be well, and know that we're here for you now and always. But thanks so much.
Right. I don't know if we have additional questions. Thank you, Colleen, for the very thorough information that you provided. And I encourage all of you to please take a look. There's a lot of really helpful information there. And I also want to say thank you for taking time today to get on your computer, to log in, and to take all this information in. I know it can be a little bit tiring to have to log in and do Zoom communications, but we love staying connected with all of you. We want you to know that we care, that we're here for you, and that we're advocating for and with you. So please stay in touch with us via our social media platforms and through the website and through our autism response team. And we will stay in touch with you too as we continue to advocate for meaningful supports and services during this very challenging time. Be safe, be well, and we will be in touch. Take care.
Thank you, everyone.